Most key parts of the NHS are running at full stretch. Record numbers of ambulance calls illustrate that, and in some areas, staff say they've never known pressure quite like it.
We've been under extreme pressure for the last few weeks. We've put extra resources on to try and cope with the pressures, but obviously with the delays we're getting at the hospitals, it's causing quite a few problems for ourselves.
One of the main pressure points on the whole system is the increasing number of people arriving at hospital accident and emergency units, and there's a debate about precisely why that should be happening. Could the NHS 111 helpline, for example, be encouraging more patients to go to hospital?
Good afternoon, you're through to the NHS 111.
Critics say 111 call operators have a list of questions which too often results in advice to go to a doctor or a call for an ambulance.
Because it's not run by healthcare professionals, it means that more of those patients are likely to be transferred onto other services, and they're likely therefore to turn up in places like A&E departments or indeed GP surgeries for second opinions to find out what is actually causing their problem.
Like today?
But NHS chiefs deny that 111 has added to pressures on the system this winter.
We are confident that 111 categorically is not the problem behind the pressures that have been seen in A&E. In fact, it's one of the clear elements to solve the issue in the long term. It takes away the demand.
It's not just about people going into hospital, but what happens when they come out, with problems in some cases finding places in local communities where patients' treatment can be continued. Social care is under strain, so discharges of patients can be delayed. While some hospitals work closely with local authorities to move the elderly back into the community, others struggle. Social services blame a lack of funding from government.
Over the last 4 years, we've had a 26% reduction in our budget, £3.5 billion taken out of social care in this country as needs are rising. So that's a major reason why the pressures are so significant.
The current state of the NHS fuelled fierce exchanges in the Commons.
I think that is disgraceful. The NHS is not a weapon, it's a way we care for our families, it's a way we care for the elderly, it's a way we look after the frail. So perhaps when he gets to his feet, he will deny that he said he wanted to weaponise the NHS, a disgusting thing to say.
I'll tell him what's disgusting. It's a Prime Minister who said people could put their trust in him on the NHS, and he has betrayed that trust.
BBC News today contacted 64 NHS trusts and boards around the UK to ask the number of beds currently unavailable reported as occupied by patients ready for discharge. Hugh Pym, BBC News.